So we, like I mentioned, with some colleagues, put out a case series looking at young patients being treated with interferon. So again, it's not something that pediatricians think of necessarily upfront because it's not something we have a ton of experience with. The patients in our cohort were really a great representation of pediatric and adolescent age. They ranged from, I think, 3 to 21 years old. We have used it in patients with both ET and PV. We found that it was really very well tolerated for most of the patients. There were a few patients who did have to come off the drug. We know that some of the side effects associated with interferon could be unmasking psychiatric illness such as mood disorders, anxiety, depression. So there were 2 patients who had issues with that and decided to come off the medication, which is appropriate. And we do know that interferon can cause transaminitis or temporary increases in your liver enzymes. So usually when you stop the drug, that goes away. And that happened to one patient. He had previously had a liver transplant. So on interferon, it was noted that his liver enzymes were increasing. When the drug was stopped, that symptom resolved. So he did not continue on that medication. There have been cases, we did have a couple of kids who had thrombotic events while on interferon. We didn't think that was due to the interferon, but we did think it was part of their disease progressing despite being on interferon. But the other children all did very well. And we've had patients with decreased phlebotomy requirements. We've had patients with real significant improvement in symptoms. And one of the things that we hope that interferon is providing also is decreasing the risk of disease progression, especially in our young patients with polycythemia vera. There's been data on that in adults. And so we hope that translates to young patients as well. So I think interferon is a safe medication. I think it's well tolerated. I think we have many years of experience, and I think it's something that people are using more and more again these days, despite having lots of drugs available to them and lots of clinical trials ongoing in adults. I think in pediatrics, we're starting to use interferon more, and I'm glad because I think it gives families a lot of choice as opposed to just having hydroxyurea. Some kids don't like a shot. Some kids don't like a pill. I think the thought of having a medication that can really slow disease progression or improve marrow fibrosis or put the disease into a remission is really appealing to families, again, because these are chronic diseases in kids and they're going to have them for what we hope a very long time. So I think the option of having interferon for young patients is a good one. And I think a lot of patients seem to be gravitating towards using that instead of hydroxyurea. So again, I think everything really comes down to what works for that family and that child or that young adult. But I think the more options we have for families to think about and discuss, I think the more they feel like they can be in control of their child's treatment and they can make the right choices for their family.